that's what's happening.
Let me just say that first of all, I want to thank you all for being here, and this is a subject that's not going to go away. It's one that affects all of us, and every one of you all know somebody in either your immediate family, extended family, or close friend that's been affected by some sort of drug abuse, whether it's prescription drug, legal prescription drug abuse, or illicit drugs. So it's an epidemic problem that we're facing in each one of our states. Here we have with us Senator Klobuchar, Senator Shaheen, Senator King, Senator Heitkamp, and Senator Baldwin. All of our states have been severely affected. I want to start out by saying that all of us recognize that 20 years ago it was treated as a crime. We put people in jail. And no matter what you did and how you abused or used, if you were guilty of either illicit use or abuse, you went to jail. We locked them up for 20 years. We finally come to grips, I believe all of us have, that basically drug abuse, if you will, addiction as we know it, it's an illness. An illness needs treatment. And I can give you some statistics of what we're dealing with here. 18,893 people died due to prescription opiate overdose. An average of 51 people die every day, just of legal prescription. This is not illicit drugs of heroin and cocaine and all that. The trend is moving in the wrong direction as we know it. 16% more people died in 2014 than died in 2013. We've lost almost 200,000 Americans. 200,000 Americans. This is not a war or conflict anywhere around the world. It's not some Ebola or Zika. This is truly something that we have and should have control over. And we've got to do something about it. In fact, between 2009 and 2013, only 22% of Americans suffering from opiate addiction participated in any form of addiction treatment. Only 22%. So when you think about the need that's out there, and I'll give you an example of my state, and each one of the senators will touch on what they're dealing with. In 2014, 42,000 West Virginians, including 4,000 youth, sought treatment for some form of drug abuse, but failed to receive it. That's 42,000. West Virginia has the highest death rate per capita in prescription drug. That's legal prescription drug abuse. The largest long-term facility in West Virginia with more than 100 beds is Recovery Point. It's run by all recovering addicts and has the most success rate of anything we have going on in our state. They have a 4 to 6 month long waiting list just for them to be able to be evaluated and seen. 2014, about 15,000 West Virginians received some form of drug or alcohol abuse treatment, but nearly 60,000 West Virginians were identified as in need of substance abuse treatment. So based on conversations with West Virginia State Police, 8 out of 10 of every call they answer is drug related. I think nationwide it's probably 40 to 50% or greater, but each one of you all know when you talk to your law enforcement in your state, it's unbelievable. Some form of drug-related act is happening, and they're called to do that. So the bill that we have before us, it's pretty easy to understand. It's called Lifeboat. It's Benefiting Opioid Addiction Treatment Act. I don't think there's a more appropriate name that we could give it than that, because people are looking for a life ring, if you will, or a lifeboat that might save them, and this one, what we are doing here, does. We're going to get smacked by all different sides, and here it goes, another tax or some type of a fee or this or that. But when you think about it, we have, for alcohol, we have an alcohol tax. All states have it. For cigarettes, we have a cigarette tax, because we know that it does harm to you, and we know that we have to deal with it. We have nothing with opiates that's been an epidemic proportion for more than a decade or 2 decades, and we've done nothing about it. This is 1 penny per milligram. 1 penny a milligram is all it is. Now that's something that people are saying, well, that's not going to solve the problem. Well, basically, if you don't think that this is an illness and needs treatment, you're probably disagree with us. If you've come to the fact and realization that it is an illness and it's going to have treatment, you have to have treatment centers. And with the budget restraints that we have now, and every time we try to do something, our colleagues on the other side says, well, you have to have a pay for. Well, guess what? We have a pay for. This will pay for it. This can generate anywhere between $1.5 to $2 billion a year. Now, the people who say we can't afford this, it'll add cost and this and that, let me just tell you what we're dealing with right now. We have spent more than $1 trillion on the war on drugs. More than $1 trillion. $20 billion to fight the drug gangs in home countries. $33 billion on marketing. Just say no. We were trying to educate and just say no to drugs. You remember that? $49 billion for law enforcement along America's borders. $121 billion to arrest more than 37 million 37 million nonviolent drug offenders, about 10 million of them for possession of marijuana. And then you look at the 2014 healthcare costs associated with opiate abuse was $25 billion. West Virginia accounted for just our little state, $99 million of that cost. The other thing that we failed to even mention is $450 billion to lock these people up in federal prisons. $450 billion, what we could have done with that money in these type of treatment centers. So yes, we're willing to step to the plate, put our name to a piece of legislation that does have a pay for it, will take care of itself, and start basically attacking the addiction that we have. And we've come to the realization it needs to be done. We hope all of our colleagues understand that too. So with that, I want to turn it over now to my friend Amy Klobuchar from the great state of Minnesota.
Thank you so much, Joe. Thank you, everyone. As you know, we have a bipartisan bill, the CARA bill, that came through the Senate, and we're proud of that bill. I was one of the chief authors on it with Senator Whitehouse, Portman, and Ayotte. Senator Shaheen has played a major role in pushing for funding, as has everyone up here on this stage. But I think we all know that bill is a floor, right? It's a beginning. And what really matters here is getting people off these addictions and getting things done for them. And the way you do it is, one, better prescription drug monitoring, which we'll leave for another day. But I literally met someone, a doctor, who saw a patient who had seen 108 different prescribers. That's how he got his pills, right? Because people are going in our part of the country from state to state to state, from doctor to doctor to doctor. We have to do a better job getting the drugs out of the medicine cabinets. We have to do a better job on making sure when first responders come that they're equipped with naloxone, and then we can help to reduce these deaths. But I put right up there, up front and center, treatment. I come at this for two ways. Number one, a former prosecutor. When I was there from 98 to 2006, overseeing our biggest prosecutor's office in our state, we were just starting to see the beginning of this. Most of our heroin users were pure heroin users. They didn't get their start on prescription drugs. Well, now 4 out of 5 heroin users get their start with prescription drugs. But this is an epidemic. Joe gave you the statistics. This is real. We lost over 300 people in my own state in just 1 year. The other thing I know from that experience, having overseen our state's biggest drug court, that treatment works. Treatment works there, and treatment works in rural areas. But as someone said to me last week, I shouldn't have to commit a felony to get treatment. Right now, one of the surest ways someone can get treatment in my state and in others is by committing a felony and going to drug court, because it is so difficult otherwise with the way insurance works and other things work to actually get the treatment that they need. And that's what this bill is about. It's about funding the treatment so that if someone gets an addiction, we know treatment works, especially intensive treatment. They can get off these drugs. And the last thing for me, this is personal. My dad, the whole time I was growing up, struggled with alcoholism. He got 3 DWIs, and nothing worked. Finally, on the 3rd DWI, when there was better treatment available, and when this prison was hanging over his head, he actually went to treatment, and he actually got treatment, and now he is 88 years old and happily married and sober. Okay, it takes a while, I understand that. But I saw it work, and as he said in a book he wrote, he was pursued by grace. Well, I believe all of these addicts who've gotten hooked by simply going to the doctor because they had a back problem, or because they had some other health problem, they started taking opioids, and there's something with their chemical mix made them addicted, they don't get treatment. That's wrong. And there's a lot of people that have been profiting off this epidemic. A lot of companies had made a lot of money off these prescription drugs. So all we're asking is they put a little bit back to stop the people's addiction that resulted because of their drugs being out there on the market and being abused. I appreciate your work.
Now we're going to have Jean Shaheen. Jean's been fighting this on the front line and fighting every way we can to get funding to take care of people. And when we finally come up with this, she was one of the first ones that says, count me in. So, Jean, you're in, honey. Thank you.
Well, thank you, Joe, and thank you to all my colleagues who are here. Thank you especially for your leadership in developing this lifeboat legislation, because it truly is that. We all understand, because we've seen it in our states, we've seen it nationwide, we have a problem with opioid and heroin abuse in this country, and we've got to address it. And Washington has not done enough to do that. Everywhere I go in New Hampshire, I hear we need more resources. And The CARA legislation was great, but it doesn't provide the resources to the front lines, to our communities, and to our states to deal with it. In New Hampshire, we have a population of about 1.3 million. The estimates are that over 100,000 people in the state of New Hampshire are dealing with some type of substance abuse. And we know the statistics nationally are that only 1 out of 10 people are getting the treatment that they need. Last year, we lost 3 times as many people to heroin and opioid deaths as we did to traffic accidents. We can't continue this way. You know, the hospitals and the jails have become our places of last resort for treatment. I talked to the head of a hospital in a small town in New Hampshire who said, we can tell when there's a new batch of heroin on the street within an hour because we see half a dozen people in our emergency rooms with overdoses. In the city of Manchester, our largest city, they have now designated firehouses in the city as safe havens so that they can try and provide help for those people who can't get treatment but who need some place to go so they can get off the street. What this lifeboat legislation would do is provide the treatment that we so desperately need throughout this country to make sure that people who are ready to get help can get the help they need to get off the streets. And you know, if you don't support it because it's the right thing to do, you should support it because it's the cost-effective thing to do. Because as Senator Manchin and Senator Klobuchar said, it's cheaper to provide treatment to get people back becoming productive citizens than it is to put them in jail, in emergency rooms, in places where they can't become productive. So I hope that we are going to get support for this legislation and get it done.
Thank you, Jean. Right now we have my good friend Angus King, and he's Northeast has been ravished by it also, and Angus has been fighting the front gallantly. So Angus?
Since we started talking about 20 minutes ago, 2 people have died in America of addiction-related overdoses. And an important point that Amy Klobuchar just mentioned is that 4 out of 5 new heroin users start with prescription drugs. So prescription drugs is a target of opportunity to try to do something about this scourge. In my state of Maine, it's the most serious health-related, actually one of the most serious issues I've seen in my adult life. We're losing 250 people a year. It is a true tragedy. It is tearing families apart. I've been to roundtables around the state, sat next to a deputy sheriff who lost his 18-year-old daughter to a drug overdose. What this bill does is pretty straightforward. It provides that a little tiny piece of the cost of the drug will go back to deal with the inevitable dangerous side effects. These drugs can be wonderful and life-saving and pain-reducing for people, particularly cancer patients, but they have a dangerous side effect. And what we're talking about is to simply take account of that fact and put a little piece back in order to provide treatment. We have a situation in the United States today where the number of treatment beds is actually declining at the same time the demand is skyrocketing. And people, I think the number is 1 out of 10 young people that needs treatment, that wants treatment, that's ready to take that step, can't get it, either because it's simply unavailable or because of cost. Now, last week we passed a spending bill, an emergency spending bill to deal with an incipient epidemic, an epidemic that hasn't come yet, but we think will. And I supported that bill to deal with the Zika problem. I think that was the right thing to do. But I don't understand why we can't deal with an epidemic that's upon us right now and that's killing people at the rate of 5 an hour, every hour, 24 hours a day, 365 days a year. This is an epidemic. This is killing people. It's tearing families apart. And we passed the CARA legislation, and it was a good piece of legislation, but it had no funding. That's like sending the fire department to a fire and not giving them any water. We'll give you your water in October. That doesn't do any good for the people that are dying today. And to me, this just makes common sense. As Joe said, we have a tax on cigarettes. A significant part of that in many states goes into treatment and prevention. The same thing with alcohol. We're not talking about generating funds for the general revenue that's going to disappear into programs that people don't understand or support. We're talking about specifically putting this money into treatment. And we know that treatment can work. It doesn't always work the first time. Sometimes it takes 2 and 3 times. But it can change and save lives. And I think we have a responsibility to do that. And I believe we have a responsibility to pay for things. And that's what this bill is talking about, and it's paying for it in a very logical way. Because the product can be beneficial, but it can also be dangerous. Let's simply require that a small piece, and the tax would only apply to the opioid share of the overall prescription, not to the entire pill, but a penny a milligram. And we're talking about a relatively small piece that would generate money for treatment that in turn would save money for every state and for the federal government throughout the country. The returns, I don't have an official estimate on this, but probably 10 to 1 would not be an unreasonable estimate in terms of the cost versus the benefits to society. And you can't put a value on people's lives. So I believe this is an important step forward. It's a responsible step forward, and it's one that we should take much sooner rather than later. Every day that goes by that we don't do something about this, over 100 people die. And that, it seems to me, ought to be in our minds as we're thinking about how to deal with this issue. And
Let me just say, you can tell it's a very passionate issue for all of us because we've all been affected by it. But and the states that do a lot of the heavy lifting, manufacturing, mining, and all the things that the country depends on, seems to be hit just about harder than any other states because people do have pain and they do want to be comforted by that. And this is what the path of least resistance has caused. But Heidi Heitkamp of North Dakota is on the front lines of this every day, and I appreciate her being so much involved in this. Heidi?
I don't think it's any mystery why you have 3 governors here, because governors ultimately are accountable to the public to actually get something done, not just pass legislation that says these are all good ideas. These changes need to be made, but if you don't put a dime into prevention and treatment, none of that matters, in my opinion. None of that matters. And I'll tell you why I know that. As a former Attorney General for the state of North Dakota, we tackled in the 90s the methamphetamine epidemic. We saw methamphetamine coming up. It was cheap. It was being manufactured, but about 95% of what was consumed in North Dakota was in fact brought up from Mexico. And the cheaper it got, the more people used it. Let me tell you, it's not for me just opioids. We have a recurrence of methamphetamine abuse in my state. What does that mean? It means that the guidance counselor up in Williston, who is working with one of the students at the college there, who comes in distraught because her boyfriend's on heroin and methamphetamines, finally convinces him to come in and get treatment. Now, anyone who knows anything about treatment knows that's a huge opportunity, and it may not come around again. That time when you step forward and say, I want help, that's not something that happens every day. That's something that something happened to you, that you hit rock bottom, you're there. They said, come back in 3 months. That's when we're going to have treatment for you. Now, I'll never know whether that young man was a statistic in Williston, a heroin overdose statistic in Williston. I'll never know that. But I'm sure someone like him was. Let me tell you, I was on Mandan, Hidatsa, and Arikara Nation, visiting an outpatient program, addiction program. It was designed originally to deal with alcohol. They're being overrun. That very moment, that I walked through the door, they had gotten 2 calls. One from a grandma who said her son was going to commit suicide because her grandson was going to commit suicide because he was so distraught, and she wanted to know if she could bring him in for treatment. He said, we don't have enough treatment here. Up at Fort Peck, people are selling their children into the sex trade for their fix. Anyone who thinks that this doesn't have long-term consequences for communities and for America is wrong. This is devastating communities, especially communities hit hardest by the downturn, especially communities in poverty. And if there's going to be hope going forward, we have to provide treatment. We have to get our heads out of the sand and start realizing that simply passing bills, changing a few outcomes, is not going to do it, and it's not our job. That's not doing our job. Our job is to get treatment. Our job is to work with state and local officials to make sure that we have, if this were breast cancer, we'd have pink ribbons marching down the street, and I can say that as a breast cancer survivor, because that kind of public health movement saved my life. But let me tell you, we need a public health movement in this country that's funded the way we funded tobacco programs, which I also know a little bit about, the way we funded other programs to tackle these challenges. And if we don't do it, we will look back on this time in 5 years and say, we failed. It has only gotten worse. We cannot supply side our way out of this. We got to deal with the demand. And we've got to deal with helping families. And tell one final story. Mother called our office in Fargo, said my daughter was a straight A student. She's now addicted. She now desperately needs treatment. There's no treatment for my daughter. I can't afford to send her to all the fancy places that you read about. And she's going to die. And I hope she gets arrested. Because as Amy said, in order to get treatment, you got to commit a felony. That's not the way it should be in America. And I want to applaud everyone behind me, but particularly Joe Manchin, for his absolutely dogged determination that this cannot happen on his watch. And he has been a great leader, as has been Jean Shaheen. But understand that you can look at the death statistics, but until you have seen communities ravished, until you have seen families in despair, you can't, you've got to actually understand what's going out there, because we've got to be motivated for change. And so I am hopeful that others will see the wisdom of this proposal, that all the people who come in to see us, family members who have lost loved ones, will assist us in motivating other colleagues to sign up, because we cannot let this go another generation and expect good outcomes in this country. We have got to fix this problem now. So thank you, Joe.
And finally, we have basically with us from the heavy lifting state. When I say heavy lifting state, Wisconsin's been a tremendous manufacturing state and has always been able to provide the country what we needed. And Tammy has represented it in so many different capacities, the state legislature, now as a United States Senator. Tammy Baldwin.
Thank you. You know, this epidemic is unique in a number of respects, and you've heard my colleagues talk about it, that for so many addictions, the sole source is an illegal source. But so many people who are facing opioid addiction got their first supply from somebody trusted in the medical community, maybe as a result of an injury, maybe a minor surgery, maybe something to actually treat continuing pain. There's also a lot of stigma surrounding addiction. And I think we would probably have a louder outcry across the United States, since so many are affected, if people didn't feel the stigma before stepping forward and demanding a response. Like my colleagues, I've been holding roundtables throughout the state of Wisconsin, listening to people who have recovered from addiction, who have lost loved ones to addiction, parents who have children or other loved ones who are continuing to struggle with addiction. And over again, I hear about the lack of treatment opportunities, options for their family members. It is time that, given this big problem, the federal government step up beyond the ways we have already. CARA was, as my colleagues have said, a very, very important first step. But it is empty policy and empty rhetoric if there are not dollars that go along with it. And This Lifeboat Act is truly the way forward, because given the unique aspects of this epidemic, it's so important that the medical community and the pharmaceutical industry step up along with nonprofits and local government, state government, and federal government to craft the solution. I am proud to support this bill and stand with my colleagues because it is a bold solution to get the treatment dollars that we so desperately need. We have to think in comprehensive terms when we're confronting such a major epidemic: prevention, crisis intervention, like supply of naloxone to reverse overdose symptoms, treatment, and remember that recovery is a lifelong commitment, and we need to be standing by our citizens who take those steps. So today we face an issue that should unite us all, and I look forward to advancing the Lifeboat Act along with my colleagues.
Thank you, Tammy. Let me just say, in wrapping up, and if you have any questions, we'd be happy to take them, or any of the senators here. You see 6 moderate Democrat senators standing here.
And
3
independent.
And 1 independent and 5 moderate Democrats standing before you. 3 of us were governors, 2 prosecutors, legal advisor, and state legislature who's worked on the ground with Tammy, but all of us have been on the front lines. And we know what it takes in order to do the job, and you have to have leadership. But the bottom line is it's not political. We wish we had our Republican friends standing here, and I do say Republican friends because we consider all of us as having friends, and 100 of us should be all very good friends. There's not one person will lose a vote over this. Not one person. You cannot be accused of say, I'm voting for a tax. Well, you're not voting for a tax to expand a social program or an entitlement program that everyone gets criticized no matter how good it may do or if they think it's wasteful. This is something that's much needed, overdue, and they all recognize it, but they're scared to death. They've taken a pledge. Scared to death who's going to use it against them. I'll be standing side by side with any of my Republican colleagues if a Democrat tried to attack them and say that they voted for a tax. I would be happy to stand by their side and say that's wrong. These people had enough courage to vote for something that was a cure and a treatment that's needed all over this country. And there's not one of them, wherever state they represent, not one of them doesn't have the problem. Not one of them. So we've put we know the hard, difficult times we're in. We know it's hard to get a budget and basically to do anything in a bipartisan way. So you've got to find pay for us. And we're willing to put our name on it, willing to stand up front and say we want to basically go out and treat the addicted American. Let me just tell you what we're all dealing with right now. And my state's affected the worst again. I have the lowest workforce participation in the nation in West Virginia. I have fallen below 50% of people that could be or should be working, not working. Now you might say, well, they're just lazy, don't want to work. That's not the case. 3 things keep you out of the workforce. Either basically that you have an addiction, you have a criminal record, or you have a lack of skills. So education, criminal record, or addiction. Either a combination of one of those 3 or all 3. Now something's wrong, and I'll tell you one thing. Most of them is basically with a criminal record and addiction. They can't pass a drug test or they can't get a job even if they do get cured. There's so many things we need to do, and we're going to take them all on. The FDA has to change its culture. The DEA has to change how they enforce and what they go after and how we dispense. All this needs to be attacked, and we recognize all this. But right now, we can't get 44,000 West Virginians treated. I can only imagine every state people are coming to them. We get letters every day. My child wants help. What do I do? So, anybody have any questions? We're all very passionate about this issue. Yes, sir.
Yeah, obviously it's hard to get any tax passed through the Republicans. You talked a little bit about that. You talked a little bit about the pharmaceutical industry, which, as Senator Klobuchar mentioned, has made billions of dollars of profit off of these drugs. Do you think there's any chance they might be willing to go along with something like this, or do you expect they'll be sending their lobbyists to come talk to your colleagues and say,
this is oh, I'm sure of that. You know one thing, and I don't begrudge anybody. I mean, I understand the business models, the business plans. This is devastating the entire nation, state by state, community by community, family by family. This is not Democrat or Republican problem, and here we are going to throw money at an entitlement program. It has nothing to do with that. But as you said, we just passed CARE with no money. And Angus, it is. It's worse than setting a fire, to a house without any water. But the bottom line is it's no one's willing to step to the plate. So I kept thinking about it. I said, I talked to my friends and all of our colleagues. I said, listen, we know that drugs, that alcohol is bad. We wish you didn't. I wish I didn't collect a penny of alcohol tax or a penny of cigarette tax. I hope we don't collect a penny of opiate tax, if that's what they want to call it. I'm challenging every pharmaceutical to get all their brains together and all their scientists and give us something that is not addictive, that changes and alters people's behavior in their life. Find it. If this spurs you on, so be it. Or if you want to sit down and talk to us how we move forward, but they've got to be part of the solution. They got to be part of the solution, and that's all we're saying. This will bring them to the table, hopefully, bring our Republican colleagues and friends to the table. Now, not one of them can say, we don't have that promise, I don't need to do this. Not one of them. And there's not one of them that will lose one vote by doing it, because I'll guarantee you, it's attacked the Republican households as much as it attacked independents and Democrats and everybody else. So their constituents is affected. At least they can say, well, we're glad you're trying to do something. So I think if they'll just reach out, if we get in this political hyper bubble that we're in here in Washington and they're scared to death because someone's going to try to use it, I'm telling them I would stand with them. I'm happy to stand with them and says, finally we've come together to try to cure something that we're all being affected by, and it's not politics. It's basically drug abuse and no way to treat it.
I'm assuming you've talked to some of your Republicans.
I have.
And they have signed those pledges, and they are worried about primaries where, you standing next to them may not help them in a primary. That does seem to
I'm not saying that I've had any takers yet. Yeah, but the bottom line, if you were a Republican that signed a tax pledge, but your sense of duty and you took an oath to protect the people of your state and the United States of America, and you're knowing something's ravishing, okay, to stand there and be brave enough to do it. And then you have to ask yourself, why are you serving? Is this greater than, is our jobs more important than the people that we serve and the thing we should be doing?
I think the question really becomes, what's more important, saving lives or honoring a pledge that you probably shouldn't have taken to begin with? I mean, really, where are the priorities? And to me,
Can you speak to the mic?
yeah, I said I think that what you have to ask is what's more important. When we've basically been confronted with crisis, people pull together and they try and solve problems. And maybe some of the ideology and some of the past stuff that was done in the context of kind of normal things, you can't pay attention to that anymore. They've got to start paying attention to what's happening. And let me tell you, on the ground in their states, people want treatment. They want hope. And we've got to pay for it. I mean, I think Angus made that great point. But you know what? What we're offering is not a tax. What we're offering to families who are being ravished and communities who are ravished is a lifeboat, but it's hope. It's hope that things can change.
I just wanted to add one thing to the question about pharma. When we just had an event at Hazleton, Betty Ford, which is based in Minnesota, with Botticelli came, and we were talking about this. The chief medical officer, and I can give you his name, from Hazleton, said these drugs were never intended or are not effective in the long run for long-term pain control. That's not what a lot of them were meant for, and they've turned into that. And there are, of course, medical situations where you need them, but they have been prescribed for things that they should not have been prescribed for, and in quantities, and the drug industry has let it happen. They have let it happen. And they have made money off it. So when I look at what my friends on the other side of the aisle have agreed to, I would agree with Joe and Heidi here. Times change. You make decisions. The tobacco treatment has worked. We've seen a reduction in people who are addicted. There were Republicans in states, legislatures, and in the federal level that voted for those things along the way. You see a problem and you respond to it, and this is a crisis.
Do you see it just like the tobacco fight, where tobacco companies didn't really want tobacco treatment? They didn't really want those tobacco taxes, and if the tobacco treatment is successful, they lost a customer.
Mm-hmm.
Do you see that as the same fight here?
Well, it depends how pharma responds. If they come,
want to lose their customers, if they sell 50 pills instead of
let's see what they say about the bill. If they support the bill, it'll be
I would look
different.
at everybody in the pharmaceutical industry, no matter what spectrum they're on, and ask them who in your family or who closely to you has been affected, and how are you doing, how are you treating it. You might have the wherewithal to do that. Guess what? Most of the people we represent don't have those same wherewithals that you do. We're just asking for the compassion. That's all. And we're willing to stand strong on this. You want to sit down and find a cure? Fine, we'll work with you. We'll do whatever you want. But there's been more opiates. There's an article came out today in my paper back home, my home paper, that the drug companies and basically, when you have a distributor sending into a community of 800 people 2 million pills, you think something may be wrong? So we have this happening all over, and this is going, the lifeboat, there's not a better description of what we're trying to do than a lifeboat.
We have 5% of the world's population, and we consume 85% of the world's opioids. And you think about, again, what so many of us noted, the overprescription. These were originally approved for use for pain for chronically ill cancer patients, where the worry of lifelong dependence, abuse, addiction was much lower. Now they are used in so many different, somebody who has had a minor dental surgery or surgery, and they don't get 3 days supply, they get 3 months supply. I had heard anecdotally that diverted pills, i.e. leftover pills found in household medicine cabinets, can be sold on the street for $90 a pill. You wonder why you hear about heroin. Heroin in some communities costs less than a diverted pill from a medicine cabinet. This is what we're facing, and yes, I believe, and my colleagues have said this too, that the pharmaceutical industry needs to step up, as does the medical community, to be responsible and be a part of our solution.
Angus, we're going to wrap up. Heidi, you okay?
I'm good.
We're going to wrap up, but thank you all, and Angus is going to wrap it up for us.
All cars in the United States are required to have seat belts and airbags. They cost the manufacturer something in order to install that safety equipment. Cars are very useful and important, but they can also be dangerous. And our society has recognized that by building safety checks into the cost of the product. This is exactly the same thing. These pills can be useful, but they also have a danger and a cost. And this is simply a way of saying, if you're going to manufacture and produce these products that have very dangerous side effects that everyone understands and knows, and you understand and know, you need to build into them some safety measures. And in this case, we're building in the treatment option for those people that get trapped in the scourge of addiction. Now, I'm one around here who's very concerned about the budget and about shortfalls, and that we can't keep borrowing our way from our children. We can't keep borrowing from our children. This is a responsible, conservative with a small c proposal to pay for something that we desperately need. Last week we appropriated $1.1 billion, which by the way was borrowed, for the Zika epidemic that hasn't happened yet, and yet we're not willing to pay for an epidemic that is destroying our communities and our families. So that's why I think this is it's a responsible proposal. It's a creative one. I congratulate Joe Manchin for coming up with the idea. But to me, it's building into the product a recognition that it can be dangerous and dealing with the dangerous side effects. So we're optimistic, and I believe, as Joe has repeatedly said, this is a problem that affects every state in the country, particularly rural states, and it's one that we simply have to address. If we don't, we're not doing our job.
Thank you all. Thank you. I appreciate it. You are. Hey, Angus,